Okay, right. Hi, Chris.
Yeah.
What can we do for you today?
Well, I've just been feeling not right for the last few weeks. Quite tired. Not really sure. I am tired, but I'm not really sleeping, even though I'm so tired.
Okay.
You know what I should do about it. Well, I keep waking up as well.
Right, we're not sleeping very well, waking up early.
But I'm tired.
Tired, right. So that's been going on for a few weeks or longer, do you think? Or
About weeks. Yeah.
so again, not sleeping, waking early, and feeling tired. Yeah.
Just down, I suppose.
Right. Is it down? What do you mean by it down?
Just, well, I haven't really been looking forward to going into work. And,
Right. But can I just remind myself, where do you?
I've worked at the GP practice, but not this
Oh,
one.
yeah.
Yeah, I'm just a practice nurse.
Right. Yeah.
But recently I don't know, I haven't really felt like going in, and it's a bit tricky at the minute.
So the work's a bit tricky, or
Yeah.
so that's been for a couple of months now, you think, or longer? Or?
So just a couple of months.
Right.
But certainly, I can talk to you confidentially.
Yes, absolutely, yeah.
Just because, well, I did have, there was somebody made a complaint about the work,
Right.
which hasn't been very nice. So obviously I've been quite worried about that as well.
So was that about the time you started feeling like this? Or? Yeah, so that's, what stage is that at the moment?
I had a verbal warning
Right.
about it. And since then, obviously, I've been really worried about all the other, like I'm double checking everything.
Yeah.
And I know they're not, but I'm just aware that people might be talking about us at work a little bit and
Right.
keeping an eye on it a bit more.
So has the verbal warning, is that sort of concluded?
Yeah.
Aside from work's point of view?
That one has, yeah.
Do you think there'll be any further comeback from that?
Not from that.
Not from that.
But there are other things. I did file some things with that child and they really did attention. But that's what I'm worried about now. I'm letting people down.
So has that been more recently?
Just last week.
Just last week. And were they picked up or?
Yeah, they were. And one of the partners did have a word with us about it. It's just all these things now. I'm starting to, because I'm going home thinking I've done everything right at work today, and when I'm waking up early, I'm thinking
lots of things.
It's going to be a horrible day.
Then round in your mind, yes. How are things otherwise at home?
No, not brilliant. Because he's not very well. He's got angina. My daughter's not having a great time at school.
So there's quite a lot of things going on. Yeah.
I'm not really sure what to do.
Yeah. Yeah.
So,
Feeling pretty low and pretty down, really. Have you ever felt like this before? Before you would have never had episodes like this before? Or, But a lot of things happening all at once, really. A lot of stresses all at the same or at a similar time. So any one of which can get you a bit down and start to feel a bit rubbish with yourself.
feel a bit pathetic. Worrying about.
Well, lots of, yeah. And one of the problems is you get into a bit of a downward spiral because of it. And because you've got a number of stresses, you feel it's difficult concentrating, a bit not sleeping as well, and then that makes it even more likely to similar things or other things happen.
Yeah, so I'm worried about thinking what to do.
What have you, I mean, you've had some meetings at work.
Yeah, I haven't told anybody at work how I'm feeling.
How you feeling, yeah.
I didn't want to add any more, I didn't want to think that I'm impotent. But I don't know what to do.
What about last week when you missed the results?
What did
the person pick those up?
It just said, it's just like a little nod, just to keep an eye and make sure I know what I'm up to. But I do know my job.
Yeah.
I just don't know why these little things are slipping now.
So you're not sleeping so well. What about appetite? Right, so not great. Have you lost any weight?
I don't think so. Not expecting that.
Yeah, not obviously. Concentration at work, not good. What about concentration at home?
I dip in and out of the zone.
Reading a book? Yeah,
No, I don't really. No. Can't really focus on anything.
What about alcohol? Do you drink much?
Probably drinking about half a bottle of wine at night.
Right, on both nights.
Yeah, I must say I have.
Has that changed in the last?
Yeah, I would never have that much usually.
Right.
But it was just sort of trying maybe
Yes. What about how do you think that's had any effect on how you feel? You're feeling pretty low, pretty down, pretty bad about yourself at the moment. Have you thought of harming yourself? Right. Not any thoughts of...
No.
Right. Yeah, so, I mean, what did you thought was going on? I mean,
Well, I'm really anxious.
Yeah.
And I mean, I do obviously feel that I'm making a bit depressed.
Right.
I know that much.
Yeah.
But when you're in it, like, sort of push the problem, isn't it?
Yeah.
I don't know what to do now.
Were there any things that you thought of that you've seen other people do or read about that you might be able to do?
I know some people exercise. I don't know if I'm a that. I don't know that was good.
Right. Any other things that you
I don't even know if that, I don't know whether I am depressed or whether it's just me.
I mean, you're describing a lot of symptoms there that fit with being depressed. I mean, not sleeping, poor appetite, lack of concentration. One of the things that perhaps would say would definitely be about alcohol, and certainly alcohol as a drug can actually make depression, low mood worse. So that's one thing that you can try and do something about yourself. I think it's easy to have a drink to feel relaxed, but it actually might be making things a bit worse. So that's something to try and do something about. Do you do much exercise?
Well, I've got my exercise, but I haven't actually been on exercise. No, still no.
Right. Again, I mean, trying to, and it's sometimes very difficult when you're feeling so low and awful with yourself to actually motivate yourself to do anything. But again, if you can, it starts to help and have a beneficial effect. Do you think you'd speak at work and tell them how you're feeling?
I don't know.
Do you think they might have an idea?
Might, I mean, I might have picked up on things, but I don't really want to hear that. I don't know whether it's a good idea to tell them.
What are you worried about? Why do you do that?
That would just make them believe that I can't do my job even more. I'm feeling like this.
Right.
I don't know how understanding would be.
How have you felt sort of speaking about it now in a bit more detail?
Relieved, I suppose.
Right.
Just to talk about it makes sense.
Mm. I mean, as I said, what you're describing is certainly the symptoms of depression combined with a degree of anxiety. And that's the sort of thing that can affect anybody and does affect many people at any given time. You've got a number of stressful things, something that happened, a mistake, or something that you've ended up having a warning about is a big event when you're a professional and want to not make mistakes. But it can happen on occasion to anybody.
Yeah.
But that can be, and then that combined with the other things going on at home, sounded to me as though it's got you into a bit of a downward spiral. And again, that can affect anybody and does affect many people. So it's not something that is a weakness on your part or something that anybody is going to judge you on and say, you shouldn't be feeling like this. It's something that can affect anybody. So you should, I think, speaking at work will be a good thing to try and do. Let them know that where you're at the moment. Have you thought about any time off work or?
I haven't thought of it. If you think it might be an idea, I might.
Well, sometimes it is when work is part of the stress.
Yeah.
Having a bit of time out from work can be part of the solution.
A little
sometimes,
bit.
yeah, a little bit, yeah, sometimes.
Yeah.
And then what are the other options? You mentioned about tablets and antidepressants.
I don't know. I'm quite reluctant to.
Do you know anybody who has taken those, or?
Yeah.
Have they been, what's their experience of them?
Well, my friend was on antidepressants for a long time. It's only I think by, at some point they stopped working for her. She changed to a different kind.
Yeah.
But I mean, I don't want to get reliant on something like that.
Yeah. I mean, just very briefly, because it comes down to your choice, but the modern antidepressant tablets that we use, in my experience, they're certainly very safe. They can be effective, and they work on a chemical imbalance that you can get into if you're in a downward spiral, and they give you initially a bit of an uplift. You then are in a better place to sort out some of the things that are getting you down in the first place. They don't work overnight, but they do work over a course of a few weeks. And in most people, once you've taken them for a period of time, which might be a few months, to just correct everything, there's no problems with stopping them. And they're not addicted in that sense. So you don't get reliant on them.
Right.
So they're definitely an option. And other options include things like counselling and discussing things in a bit more detail. Yeah. So there's quite a few things there. Yeah. I mean, is there anything that immediately you think I'd like to try or?
Probably the time off.
Right.
It would be the best.
Yeah. But I think that's got to be combined with a plan to discuss it at work and let them know why you're feeling like this. And a plan to sort of try and a bit of time off might, but then to come back and see me. You've been off work for a week to 10 days, I think.
Well, Chris, well done.
Right.
Well done, Rob.
Okay, thank you very much. Well, I don't know what you thought about that, but I would have to say I've had lots of conversations like that over 32 years. Not that all my patients and consultations are depressed and depressing, because the real joy is when she comes back in a week or two's time and she's beginning to engage with actually what's going to make her better. And in 6 months' time, and she's back to full health. And the number of episodes I've had like that, which may or may not in a week's time end up with a prescription, are actually almost countless. And how do you measure the value of having done that? I don't know. Do people want to say anything else about having watched that? That is typical general practice. Okay? You, the patient, listen, let the story evolve, tune into what's going on. When the time comes to maybe just begin to end it, think about what are the options, what can I get her to think about? There's two of you in that room. You have to solve the problem. Doesn't mean so the doctor has to solve it. You two have to solve it. Thank you very much, Doctor.
Right.